magandang gabi sir. Ako si John Emer Corrales, second year medical student ng Our Lady of Fatima University. Ano pong pangalan nila sir?
Benjamin yung Villanueva po.
Sir Benjamin Villanueva. Ngayon po, ang gagawin natin ay abdominal exam. Examinin ko po ang inyong tiyan. Tapos po, sa test pong ito, papaligayin ko po kayo. Tapos, papabudin ko po kayo kasi titingnan ko po yung tiyan ninyo at i-examinin ko po. Okay lang po ba yun sa inyo, sir?
Okay lang po.
Sir, pakibad na lang po. Sir, pakiga na. Measure ko po ang inyo. Sir. Abdominal weight mo sir. So the patient's abdominal girth is 92 centimeter. For our next test for inspection is the shape of the abdomen. So the shape of abdomen is globular because the patient has a huge amount of fat. So for our next test is skin lesion. So there are no observed skin lesion, no hypo or hyperpigmentations of the abdomen. There is no visible scarring of the skin. For our next step is for the umbilicus. So the umbilicus is inverted and no lesion, and there is no discharge of the umbilicus. There is no hematoma above and posterior to the umbilicus. All in all, the patient has a normal umbilicus. For our next step is for observation of the peristalsis and pulsation of the abdomen. So as we can see, there is no pulsation nor peristalsis observed. So overall, the inspection of the patient's abdomen is normal. So for the next step of our abdominal exam, we're going to auscultate the patient. For our first test for auscultation of the abdomen is for hearing or auscultating the bowel sound. So, first is we're going to auscultate the right lower quadrant of the patient. Right upper quadrant. Left upper quadrant. The left lower. Next step is we'll assess if the patient has a normal active bowel sound for 1 minute. So upon auscultation, the bowel sound of the patient is 24 cycles per minute, under the normal value of the bowel sound of 5 to 35, which makes us conclude that the bowel sound of the patient is normoactive. So for our next step, we're going to auscultate for bruit for what we're going to do for bruit. We're going to auscultate for the epigastric area to assess if there is a bruit on the abdominal aortic artery. Right upper quadrant. Left upper quadrant. Right lower quadrant. Left lower quadrant. So upon auscultation for bruit, in the epigastric area, right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant, there is no bruit heard. There is no bruit in the abdominal aorta, in the right and left renal artery, and the right and left iliac artery. So for our next step is the friction rub. So abdominal friction rub. Hinga malalim, sir. Hinga malalim, sir. So upon auscultating the right upper quadrant and the left lower quadrant, the patient has no abdominal friction rub. So for our next step for our abdominal examination is palpation. So for our first test for palpation is light palpation or light touch. Sir, may masakit po ba sa tiyan niyo bago kayo?
Wala po.
Wala namang masakit, sir?
Wala po.
Wala masakit, sir?
Wala po.
So upon palpating the patient's abdomen, there is no mass or tenderness observed upon light palpation. So for our next step in palpation is deep touch or deep palpation. So upon deep palpation, there is no rigidity or tenderness observed at the deep palpation. So for our next step at our palpation, we're going to palpate for the patient's liver. So for our next step in our palpation is we're going to palpate for the patient's spleen. Okay lang po sir. Sige sir, wag ka. For our next step of our palpation, we're going to palpate for the patient's kidneys. So upon palpation of the liver and the spleen, there is no organomegaly or hepatosplenomegaly observed, and so upon palpation of the kidney, so the kidney is not palpable. So for the next step of our abdominal exam, we're going to percuss the patient. For our first test, we're going to assess if the patient has general tympanism. So upon percussion, the patient exhibits a general tympanism. So for our next step is the liver span. So upon percussion for the liver span, so the liver span of the patient is 10 centimeter and is under the normal values of 6 to 12 centimeters. So the patient has a normal liver span upon percussion. So for our next steps, the throb space. Sir, makikinig malalim, sir. Malalim. So there is an absence of spleen dullness at the throb space. So that's all for percussion. So for our next step in abdominal examination, we're going to perform special test. And for the first special test, we're going to test for acute appendicitis. For our first test in acute appendicitis, going to assess if the patient has pain in the McBurney spine. Masakit, sir?
Hindi po.
Hindi naman, sir. So upon putting pressure on the patient's right lower quadrant, there is no pain. So in the McBurney's area. So for our next test is the rebound tenderness. Sakit po ba kayo
Hindi
nararamdaman,
po.
sir?
Wala po.
Okay. So for our next test is the robe sings. Sakit ba, sir?
Wala po.
Wala. Dito sa kabila, sir?
Hindi po.
Hindi rin. So for our next test is the jar tenderness. Sir, ubo kayo ng 3 beses. Masakit, sir?
Hindi po.
Hindi naman. So there is no pain in all of the tests. So for our next test is the SOVAS sign. Sir, pakiangat po. Makikita. Wala namang nararamdaman ng sakit, sir?
Wala po.
So overall, the patient has no acute appendicitis because there is no pain upon performing all of the tests. So for our next step in special test, we're going to test for acute cholecystitis. So for our first test in acute cholecystitis is the Murphy sign. So sir, hinga malalim, tapos exhale. Exhale. Masakit?
Hindi po.
So there is no pain upon putting pressure during exhalation. So there is a normal Murphy sign. So for our next test is the BOA sign. May masakit po ba, sir?
Wala po.
So overall, the patient has a normal test for acute cholecystitis, which means the patient has no acute cholecystitis. So for our next test in our special exam of our abdominal examination, we're going to perform the test for ascites. Sir, pakilagay na lang po ng kamay dito sa gitna. Nakaganon po, sir. Yeah. So for our first test is the fluid wave. Nararamdaman po ba kayo, sir? Dito?
Saan?
Dito sa kamay mo, wala naman.
Wala.
Wala naman. So for the fluid wave is absent. So there is no ascites. For our next step is the shifting dullness. We're going to discuss. So there is an absence of a shifting dullness. So overall, the test for acute appendicitis is normal. For acute ascites is normal. So the patient has no ascites. So for the last test of our abdominal examination under the special exams, we're going to perform for the costovertebral angle tenderness. So sir, pakitay na lang po. Tapos pakiharap na lang po din sa likod, sir. Masakit ba, sir?
Hindi pa.
Masakit ba, sir?
Hindi pa.
So, upon performing the test for costovertebral angle tenderness, there is no costovertebral angle tenderness. Thus, the patient has no acute pyelonephritis. So, sir, maraming salamat po. Okay na po yung abdominal examination natin, sir. Thank you po.